Hi, everybody. Welcome to Public Affairs in the Age of Coronavirus. I'm Andrea Cantora. I'm an associate professor in the School of Criminal Justice within the College of Public Affairs, and I'll be talking about the COVID crisis in corrections. Now, I'm going to focus on two things. I'm going to talk a little bit about why the prison system is vulnerable to COVID infections and how correctional facilities can prevent the spread of COVID within jail and prison systems. Now, as of November 19th, 2020, there have been close to 200,000 cases of COVID amongst incarcerated people and a little over 40,000 amongst correctional staff. There have been also 1,400 deaths of people living in prisons and jails and about 75 among staff. Now, these numbers are based on what we know of the statistics that are reported state by state, but there are likely to be a lot more cases than are being detected within the prison system. Now, the reason these numbers are problematic is because incarcerated people are infected with COVID at a rate 5 times higher than the nation's population on the outside. So this is a really significant problem. Part of this has to do with the fact that we have a lot of elderly people living in prisons and jails, people with serious medical conditions, and they have limited access to good quality health care. Generally, people in prison are in poor health because they spend a lot of time sitting around with not a lot of proper exercise. The food in prison is typically of poor quality. So generally speaking, people in prison in general have worse health conditions than those on the outside. Prisoners have higher rates of hypertension, diabetes, asthma, and other health issues. So we have a lot of vulnerable populations living within our correctional systems, which makes COVID infections a more serious problem. So I want to talk a lot about also why COVID in prison is really a big problem. If we think about the environmental, the physical conditions within prisons and the inability for people to really socially distance and quarantine when they need to, we could think about people's housing situation. Oftentimes, people in jail settings live in large dormitory rooms with bunk beds. There could be 100 bunk beds in one space where people can't physically distance from each other because the way the housing is set up. We have people also in state prisons and federal prisons where they share a cell with another individual, and all of the cells in a housing unit are very close together. People in prison and jail often have to eat their meals in a large auditorium style setting where they are sitting shoulder to shoulder and they can't socially distance when they eat. So these conditions are really complicated when we want to keep people apart. So some of the good news that's been happening because of COVID is that some states have been reducing their populations and releasing people early. And they're focusing on people who are considered nonviolent and have about 12 months left to serve on their sentence. So these individuals are being released early. Just last week, New Jersey released about 2,000 people from their prisons. And they're set to release about 1,200 more in the next few months. Maryland also this week just announced that they would release early about 1,200 people. Again, focusing on those who have shorter time left on their sentence. And the idea is to reduce overcrowding, to create ways to actually allow for socially distancing practices to be put into place. If we release more people, then we can perhaps achieve that. So that's something to look forward to or look out for because lots of states are starting to look to do that. Another important thing to talk about is that people in prison don't really have access to hand sanitizer and soap. Oftentimes, people have to buy soap out of their commissary, and not every person in prison has money to buy soap and other hygiene products. Hand sanitizer is actually considered contraband in prisons. So early on in the pandemic, this was a really big issue because they didn't have access to hand sanitizer. Some states have allowed hand sanitizer because of the pandemic, but not all states are allowing that. Also, people in prison and jails share common toilets and showers. So it's really difficult for people to maintain good hygiene in a prison and jail setting. There's also the issue of outside threats. So we have people going into correctional systems. We have staff, and we also have teachers and social workers and medical staff going in and out of prisons every day. So this is a problem because people on the outside are the ones bringing the virus inside the facility and infecting others. Most, probably all correctional and jail facilities have instituted practices that we see in doctors' offices and on college campuses and in schools where they're doing temperature checks and they're asking people about their health and if they had contact with anyone who has COVID-19. So they're doing those kind of screening things when a staff person enters the prison. And they've also limited who goes in. So in many states, teachers and social workers are not going in the way they used to. Some programs have been temporarily suspended because they want to limit the threat of outside people bringing the virus inside. Visitation in many places has been paused since the beginning of the pandemic to prevent family members and friends from bringing the virus in. So a lot of prisons have shifted to video visitation and virtual programming so people can still get the services that they need. So that's something that we are seeing across many states. Now, if you want to follow more about COVID in prisons and you want to know what's happening and you want to know what correctional facilities are doing to protect people who are incarcerated, you can look to these resources. The COVID Prison Project is every other day or so updating the numbers on the number of people infected with COVID in prison. And the CDC has also issued guidance on what facilities can do to protect the most vulnerable individuals and some practices about isolating those who do get infected and different measures on how to socially distance people in a very crowded setting. So, and I also encourage you to look to state news. Maryland often has updates on what's happening in the prisons and jails and what steps are taken to protect people on the inside. Take care. Have a great week.